Alright, we're going to talk today about two more of the glands that are part of the endocrine system, the adrenal glands and the pancreas. The adrenal glands are sometimes called suprarenal glands because one of them is located above each kidney. So the two adrenal glands are one above each kidney. Now each of those glands has two parts, cortex and medulla. We've learned about the cortex and the medulla already when we talked about the kidney. The kidney had a cortex and medulla. Again, cortex is the outer portion and medulla is the inner portion. The outer portion of the adrenal glands secrete a lot of steroid hormones. The medulla, or the inner portion, secrete two main hormones called epinephrine and norepinephrine. And these are the ones, the epinephrine and the norepinephrine, that are produced by the adrenal glands, mimic or stimulate the sympathetic nervous system that get you ready for emergencies, fight or flight. The epinephrine gets you ready and prepared for a fight and alerts everything and stops your digestive system and gets you all hyper and alert and ready to go because you don't need to digest food when you're in an emergency. And then the norepinephrine calms everything back down after the emergency is over. That's produced by the adrenal gland, as is the steroids that are produced by the cortex on the outer layer. Now, what are some diseases that affect the adrenal glands? We're going to talk about two main ones, Addison's disease and Cushing's syndrome. In Addison's disease, there's a decreased amount or decreased secretion from the cortex, or the steroid secreting portion of the adrenal glands. And because there is not enough of the steroid aldosterone, then it interferes with the reabsorption of sodium and water and causes an increased level of potassium in your blood. So you're going to have dehydration, fatigue, low blood pressure, hypotension, lethargy, can't think straight, weight loss, muscle weakness, hypoglycemia, edema, lots of bad things. And there's also something called bronzing of the skin. There's an excessive pigmentation and the skin will become yellowish brown. The treatment of this, because it's a decreased amount of steroid, is to give the corticosteroid hormones. Also, because it interferes with the reabsorption of sodium, you control the intake of sodium and you regulate the fluids to combat the dehydration. Now, Cushing's syndrome is an oversecretion of those steroids from the adrenal cortex. And that could be from a tumor of the adrenal gland, or it could be because the pituitary, remember, it is the master gland of all of them. It might be sending too much of that ACTH hormone from the pituitary and causing an oversecretion. So in this case, there's too much hyperglycemia, hypertension, hirsutism, which is an excessive growth of hair, or it goes on parts of the body it normally wouldn't show up, face, hands, things like that, poor healing of wounds, a tendency to bruise easily, and the most characteristic thing of this is something called a moon face. The face gets very round because of an oversecretion of those steroid hormones, and obese looking. If you look at page 222 in your textbook, those pictures of those two women are actually the same woman. On the left, she has the moon face of the Cushing syndrome, and then after she was given treatment, which is removal of the tumor or hormone replacement therapy, I'm not sure which she had, but after they treated her, she returned to her normal appearance. So if the tumor is the cause, they remove the tumor. If it's missing hormones, they'd replace it. This can actually happen too, not because of a problem with the gland itself, but sometimes people are put on steroid therapy like prednisone, and they'll get these same type of symptoms, and those symptoms will disappear once the steroid therapy is stopped. The next one is the pancreas, and that organ or gland is located behind the stomach. And interestingly, it's both an exocrine and an endocrine gland. So we're talking about in the endocrine system, but we also mentioned it when we were talking about the digestive system because it was organ that helped in digestion. If you remember, it secretes pancreatic juices that are carried to the small intestine by the pancreatic duct, and it aids in the digestion of food. But as an endocrine gland, where it secretes something directly into the bloodstream, it also has to do with the hormone insulin and the hormone glucagon. The islets of Langerhans are patches of tissue that are located throughout the pancreas, and they contain two types of cells, beta cells or alpha cells. The beta cells produce the hormone insulin, and the alpha cells produce the hormone glucagon. Insulin is needed for the cells to take up the sugar from the blood, and glucagon increases the blood level of glucose. So let's say there isn't enough secretion of insulin, which is supposed to help you take up the sugar from the blood. Well, if there isn't enough insulin, then the blood builds up more and more sugar because the insulin couldn't take care of it. There wasn't enough insulin. And so metabolizing the carbohydrates, proteins, all of that is affected. Now there's two main types of diabetes mellitus. The first one is type 1 or IDDM, insulin-dependent diabetes mellitus, and that type 1 diabetes or IDDM occurs early in life and it's more severe. Because it happens when you're quite young, nothing oral will help. They have to take insulin because their body isn't producing the hormone insulin. Non-insulin dependent diabetes mellitus, NIDDM, non-insulin dependent or type 2, is the mature onset form of diabetes. So it occurs later in life. It's happening earlier and earlier because so many children are obese, but it generally occurs in obese or overweight adults, and it usually can be controlled with diet or oral by mouth hypoglycemic medications. They take a pill that helps their body metabolize the glucose in their bloodstream. Some of the symptoms of diabetes mellitus: high blood sugar, excessive urination, polyuria, excessive thirst, polydipsia, excessive hunger with weight loss, polyphagia, sugar in the urine, glucosuria, fatigue, skin infections heal slowly, vision changes, and if not treated, they can go into a diabetic coma and death may occur. So to treat it, you need to regulate your diet to control the blood sugar, exercise frequently, and take the medication, whether it's oral hypoglycemic drugs or insulin injections. There's newer forms of insulin. They use insulin pumps sometimes that delivers it continuously. But over 16 million Americans have diabetes, and as many as 40 to 50% don't even know they have it. Research has proven that if you control your weight or avoid obesity and have moderate exercise, you can reduce the risk of developing diabetes by as much as 55 to 70%. So those of you that are a little on the heavier side and you don't exercise much, you need to control your weight, get moderate exercise, and you can reduce your risk of developing diabetes later in life by as much as 55 to 70%.